Dear all, today we are going to learn about hemostasis. What is hemostasis? Hemostasis is prevention of blood loss. It is a Greek word which means stoppage of blood flow. Hem means blood, stasis means stop. Hemostasis is also known as the arrest of blood flow and control of hemorrhage from a injured blood vessel. It is a process by which bleeding at any site is arrested by the formation of a hemostatic plug, or it helps in the maintenance of normal blood flow within the circulatory system. Hemostasis can also be defined as cessation of bleeding from a cut or severed blood vessels. It is a normal response to stop bleeding using platelets and the coagulation cascade. Thrombosis is another form of blood clot that occurs when the endothelium lining blood vessels is damaged or removed. Thrombosis. Its definition is pathologic formation of clot inside blood vessels. Its example is deep vein thrombosis. Hemorrhage means bleeding. Coagulopathy, a defect in blood coagulation or pathology of bleeding, for example, hemophilia. Overview of hemostasis. There are two main components of hemostasis. First is primary hemostasis, which is the formation of soft clot at the site of injury. The next one is secondary hemostasis, that is the formation of hard clot. It also means that progression of the coagulation cascade results in the formation of an insoluble fibrin mass to strengthen the platelet plug. So, what are the steps involved in primary hemostasis? Primary hemostasis is defined as the formation of primary platelet plug. It has four steps. First is local vasoconstriction. Second is platelet adhesion. Platelets adhere to the exposed subendothelial matrix directly or indirectly via BWF factor. Third is platelet activation. Once platelets adhere, they then become activated and recruit additional platelet to the injured site. Fourth is platelet plug formation. Fibrinogen forms bridges between activated platelets to form platelet plug. So let's discuss the steps in details. First one is vasoconstriction. Within about 30 minutes of damage or trauma to the blood vessel, vascular spasm ensues, which leads to vasoconstriction. At the site of disrupted endothelial lining, the extracellular matrix or collagen become exposed to the blood component. Second step is platelet adhesion. The damaged blood vessels lining release cytokines and inflammatory markers that lead to adhesion of platelets and aggregation at the site. Circulating von Willebrand factor binds to exposed collagen or extracellular matrix and act as a bridge by capturing platelets via the glycoprotein 1b, 9, and 5 complex. It helps in the formation of platelet plug and sealing the defect. Third step is platelet activation. The platelet that adhere to the extracellular matrix of the damaged blood vessels trigger the platelet to change shape by developing pseudopores, and it also undergoes degranulation. The degranulation of platelets release their cytoplasmic granules that includes ADP, thromboxane A2, serotonin, and multiple other activation factors. This further constrict the blood vessels and recruit more platelets. P2Y1 receptors helps in the conformational change in the platelet that helps in the formation of pseudopodia. Fourth stage is platelet plug formation. Various platelets are activated other to each other and the damaged blood vessels or endocellular surface leads to the formation of primary platelet plug. Activated platelets express glycoprotein 2B and 3A receptor on their surface. Fibrinogen bind to this receptor on adjacent platelets, cross-link them to form the soft temporary platelet